Hi, my name is Elisha Yaghmai. I'm a practicing internal medicine and pediatric physician from Kansas. We're launching a podcast that we hope is a little bit different from what you're used to. Our goal is to try to show you what really goes on in the world of healthcare. The point of doing this is not some sort of revenge tour. It's not to sling muck at people. We want you, the non-medical public, to understand what is actually happening with the healthcare that's being delivered to you in your own country. A lot of the debate that's going on right now centers around who pays for healthcare, right? Should it be the government that pays? Should it be an insurance company or an employer that pays? But there's not enough discussion going on about what you actually get for the money that you're spending and the many, many ways in which it can and should be better than it is. And most of the effort being exerted right now throughout the system centers around acquiring payment rather than delivering the best care possible to you. And I think you'll find that there's an enormous amount of frustration throughout the entire healthcare delivery population because we all know collectively that in general we are not doing the best possible work we could do. We are not working on behalf of you. We're working on behalf of a variety of incentives that could best be described as perverse. They were often created for reasonable reasons, but they've either outlived their use or have been perverted into things that were never originally intended. So if you'll stick with us over all these episodes, we will try to get into the mud on this. We'll start off with my personal experience so you can understand where I'm coming from and why any of this matters from my perspective, and then we will branch out into the perspective of a bunch of other people that also have their own important stories to share. We've called this podcast, Dear Healthcare, It's You. And the reason for that is because the motivation for this really is love. And what I mean by that is healthcare should be better than it is. And it's very frustrating for those of us that deliver it to see that it is much worse than it should be. So we're going to bring out a lot of things that many people are not going to be comfortable being brought into the light, but the purpose is to try to make the whole thing better. My experience is that I've worked in 29 hospitals across 3 different states. I've delivered care at every level, from the outpatient clinic to the ER, urgent care, ICU, hospital, all of these places. I have built a healthcare business from the ground up, and I've worked in all these different settings and in a variety of different specialties with all age groups as well. So my own personal experience with the system is quite extensive, as will be the experience of many other people that we're bringing into this. So I hope that you'll join us on a journey to learn more about your healthcare system, but also to try to find a better way.